Okay, for this session of YP Speaks. We have a great session lined up for you, and I thank you for bearing with us with a little bit of delay on our end in our live broadcast. So my name is Desiree Neufeld, for the coordinator, and as you can see, based on my background, I am in transit today. So the joys of technology, and we're grateful for a Wi-Fi connection. So today we are joined by Dr. Stefanie Vandevijvere. Stefanie, you can correct me and I will refer to you as Dr. V from here forward. So Stefanie is a research fellow in global health and food policy at the University of Auckland, and part of the leadership team in the International Network for Food and Obesity, not NCDs research. So monitoring and action support, which aims to implement a new framework to monitor benchmark food environments and policies globally in order to diet-related NCDs and their inequalities. So for those that are viewing from our Google Hangout page, I've enabled the question and answer box, so please feel free to chime in, and I'll be sure to monitor that and pass along questions to Stefanie as needed. I can also be reached through my Twitter handle at Desiree Neufeld, or alternatively the YP account, which is at NCD Action. So at this time, Stefanie, I will pass along the mic to you, and you can lead us in a great presentation.
Okay. All right. Thank you very much for this nice introduction and everybody joining in. So I will now try to actually share my presentation to you. So you should get that as a full screen. So is that all right? I hope so.
Stefanie, that's great. Thank you.
All right, so I'm going to start then. So thanks for joining. And so the focus of my talk is really going to be on obesity and diet-related NCD, since I have been working mainly in the nutrition field ever since I started. But of course, the discussion afterwards can be broadened and also include other NCD risk factors, and also specifically look at how progress was achieved in these areas, like for tobacco control or alcohol control, for example. So everyone is aware, of course, of the enormous burden posed by obesity and NCDs, especially also in low and middle income countries. And there's currently also an enormous response mismatch, so less than 1% of the health budget in general is spent for NCD prevention. Most recent estimates from the Global Burden of Disease studies have shown the increased contribution of the nutrition-related risk factors to the global burden of disease. So currently poor diet contributes 10% compared to tobacco at about 6%. And the obesity epidemic increased in parallel with the globalization of the food supply. So there's a push effect from the food supply driving the obesity epidemic. So nutrient-poor, energy-dense, ultra-processed food products are increasingly more available and heavily promoted and inexpensive as well. So then the question is, what can we do about it? There's actually quite high-level agreement on what can be done. There are a vast number of documents that have been produced ever since 2000. So an important one was a global strategy on diet and physical activity by WHO. There was an important UN high-level meeting on NCDs. And then the last global action plan and monitoring framework as well, outlining what can be done. But anyway, progress globally is very patchy. So many countries do actually have high-level plans for NCDs, nutrition and obesity, but few of those are actually well implemented. And mainly the soft policies, such as education and social marketing, are often preferred over harder policies, such as regulations and taxes, for example. Implementation of those harder policies is often difficult due to, for example, opposition by vested interests, government ideology, and also the translation actually of these very high-level documents to specific actions, and the prioritization of what the most urgent actions are often still debated. So my talk is now just going to touch upon some of the things related to the how question. So how can we actually accelerate progress on obesity and diet-related NCDs? So I'm sure there's more than these points. So I'm happy to hear what people have to say afterwards in the discussion. So some of the things that are important are monitoring and benchmarking, especially performance of governments and the private sector. Also gathering case studies, exemplars, and evidence. So I'm going to mainly focus on these. Strengthening accountability systems, stronger international pressure, empowering citizens and consumers, and community mobilization. So in terms of the first one, good monitoring programs are essential because what doesn't get measured usually also doesn't get acted upon. So in terms of monitoring body mass index, so one of the best practice exemplars from around the world is a national child measurement program in England, which measures all children in the first and last years of primary school on a yearly basis, so about 1 million children. And of course, one of the great advantages is a large sample size, which allows for very detailed data on prevalence and trends at very local level. And also certain subgroups of the population, and so this reveals inequalities that may otherwise be masked when averaging at higher levels of aggregation. So they do have annual data. For example, here you see by index of deprivation decile, for example, so very detailed data. Another example that you're all familiar with is the Global NCD Monitoring Framework from WHO, adopted in 2013, so including 25 indicators and a set of 9 global targets to reduce in premature NCD-related mortality by 25% by 2025. So the real focus is on health outcomes, NCD risk factors, and national systems responses. However, the really more upstream indicators, so related to policies and environments, are virtually absent, and that is quite a gap since obesogenic environments are driving unhealthy diets and energy overconsumption. So currently there's only 2 indicators dealing with that, so mainly one on restricting food marketing to children and policies to limit saturated fatty acids and trans fatty acids in the food supply. So in response to that, Informas was founded. So Informas is the International Network for Food and Obesity NCDs Research, Monitoring and Action Support. So it's a global network of NGOs and researchers which aim to monitor, benchmark and support government and private sector actions to create healthy food environments and reduce obesity and diet-related NCDs. So a new monitoring framework was developed, including 2 process modules on the top. So these modules aim to assess the extent of implementation of priority policies and actions by governments and the private sector. Then Informas has developed 7 impact modules to assess key aspects of food environments, so mainly food composition, labeling, marketing, retail prices, food and public sector settings, and food and trade and investment agreements. And another module on food production is under development. So standardized protocols have been developed for data collection and analysis in countries across the globe, and these are currently being pilot tested in a range of countries. And New Zealand will actually be the first country doing a full comprehensive national survey on food environments and policies. And so the whole idea is, of course, that these data should enable benchmarking of food environments and policies between countries and also monitoring progress over time, and then, of course, ultimately increase accountability of governments and the private sector for actions on obesity and NCDs. So I'm going to quickly zoom in into one of the modules, so the public sector one. So Informas has developed a tool, the Healthy Food Environment Policy Index, to assess the extent of government policy implementation on food environments against international best practice. So the Food EPI comprises a policy component with 7 domains and an infrastructure component with 6 domains, as you can see on the screen, so mainly related to leadership, governance, funding, health in all policies, for example. And then for each of these domains, a set of good practice indicators has been developed, about 42 in total. For example, for the labeling domain, these include provision of ingredient lists and nutrient declarations on packaged foods, existence of regulatory systems for approving and reviewing claims on foods, existence of front-of-pack supplementary nutrition information systems, and systems for labeling the menu boards. And then for each of the good practice indicators, benchmarks are sought, so actually best practice exemplars from countries around the world to actually then rate against. So the whole idea is to bring together a comprehensive expert panel of public health experts in the country who then actually rate the extent of government implementation for each of these indicators against best practice. And so this is, for example, what the scorecard looks like for New Zealand for the policy component. I'm not going to go into details, but mainly you can see the implementation gaps. So extent of implementation is divided into high, medium, low, and very little for each of the indicators, and then the same for the infrastructure support indicators. So this scorecard clearly shows where the implementation gaps are, and then in the second stage of the process, the experts actually propose concrete actions for the government and also prioritize them according to a set of criteria. So for example, for New Zealand, these are the 7 priorities that came out of the assessment. So out of a total of 34 actions that were proposed, and of course these priorities are going to be different from country to country because it depends on where the implementation gaps are. So currently this tool is also being implemented in a range of countries around the world, so mainly Latin America, Thailand and Fiji, and other countries are interested as well to do it. Another example looking at measuring private sector performance is the Access to Nutrition Index, which you may have heard about. So the ATNI index has actually rated and benchmarked 25 of the world's largest food and beverage manufacturers on their commitments, performance and disclosure practices related to both obesity and undernutrition. So the first report was published in 2013 and actually found that most companies clearly lacked transparencies, were not publicly sharing their nutrition-related practices, and also did not adhere to many of the commitments that they had shared publicly. So the idea is to do this exercise also every 2 years to track progress. And ATNI also aims to develop spotlight indices, which means for particular countries, looking at the 10 biggest food and beverage companies and do the same exercise. So this is some examples on monitoring and benchmarking. What is important as well is really look at case studies from around the world. So what is happening around the world, which policies are implemented where, what works and what doesn't, and why. So mainly case studies are important to give insight also in barriers and facilitators to policy implementation and the sustainability of nutrition policies. So a great tool developed by Cancer Research Fund is the Nourishing Framework, which has mainly been developed for policymakers. So it contains a whole set of policy areas, so mainly the same ones as in FORMAS, like labeling, food reformulation, food and public sector settings. And then when you click on some of these, you can actually see some best practice exemplars from around the world, countries having implemented certain policies in that area. So for example, a highly mediatized example is the Mexican soda tax, which was implemented at the beginning of 2014, and so it was mainly a 10% tax on sugar-sweetened beverages and an 8% tax on junk food. And recently some short-term impacts have been published, so the tax actually does work. It seems like it decreases sales of soft drinks with 10% and then increases the sales of bottled water with 13%. But apart from looking at that, it's also important to look at what were actually the factors of success. Why did the tax get implemented, while in other countries that might not be the case. So, of course, in Mexico there was a clear rationale for the tax. Mexico is the largest per capita consumer of soft drinks, and the country also with the highest percentage of adults overweight, and diabetes is really the top killer in the country as well. So billboards across Mexico City have actually ran some of these ads of a man with parts of his feet missing as a consequence of diabetes. There was a good permanent public debate, so a lot of international experts were featured in the media talking about the tax. There was permanent public debate in the media. Also, the political timing was quite lucky, since the soda tax was included as part of a financial reform package in the country. And then importantly, civil society was very well organized, collaborated very well, and had a very good, well thought through campaign. So in several steps, so first exposing the human drama through these posters and billboards with diabetes, then identifying the culprit, so which is of course the soft drink, and then also running ads on what are the solutions, so mainly using revenue of the tax for drinking water in schools. And of course, also they got funding from Bloomberg, about $10 million, to then also support anti-obesity advertising campaigns to match with the usual advertising from the food industry. So that's kind of one example. So it's important to look at these case studies and why they work and why these policies got implemented. And it's also a good thing that recently more and more of these case studies are actually published in the scientific literature, which is very helpful. So for example, public perception related to acceptance of the soda tax in France, the reasons behind the repeal of the Danish saturated fat tax, and then also a call of support for keeping the US school nutrition standards, because they were at risk of getting weakened due to certain concerns about increased food waste or certain schools not being able to meet certain goals for sodium and whole grains, for example. So case studies are important. Then the next thing is accountability systems. So these are needed across all actors to improve performance. So Vivica Kraak has developed a 4-step accountability framework, which was recently published and includes 4 steps. So the first one is take the account through independent assessment and benchmarking of progress. Share the account through communication of the evidence of progress. Then hold to account to ensure accomplishments are acknowledged, and non-compliance is sanctions, and then of course respond to the account to improvements of policies and actions. So basically the hold to account step is the most difficult one and also the weakest. So basically the main levers to hold the food industry to account sit with government, like regulations, taxes, use of food procurement, and things like that. So the levers which are actually available for civil society to hold governments and the private sector to account are usually quite weak, and so civil society has had limited success to actually pressure governments and the private sector to act strongly enough to reduce obesity. So in terms of civil society holding governments to account, so the main levers that have been used are public communications through the media, participation in policy development through government committees, and also some quasi-regulatory approaches, such as invoking codes to maintain integrity of the political process. Things like conflict of interest policies, holding registers of financial interests, and things like that. In terms of civil society holding the private sector to account, theoretically, of course, the most powerful lever would be buying healthy foods and not buying unhealthy foods, but in practice, of course, it's the industry that shapes preferences and drives demand. So in practice, the main levers that have been used are, for example, shareholder advocacy, also public communication through the media, like for example naming and shaming good or bad practices of the food industry, grassroots campaigns, for example. But here there's also some underused levers which hold promise for the future to get used more. For example, complaints to independent consumer protection agencies or supervisory authorities, such as, for example, supermarket ombudsmen, or also investment or disinvestment in company shares might be a one to explore a bit more in the future. So the next thing is increasing international pressure on governments and the food industry to act. And actually there's a lot happening in this space. I'm going to go quite quickly over it. But so Consumers International and World Obesity have published some recommendations towards a global convention to protect and promote healthy diets. So mainly modeling it to the one that is in place for tobacco control. So to have something similar to promote healthy diets. Then there's the Rome Declaration, which was adopted during ICN2 in November. So a high-level ministerial conferences, which mainly aims for global action to end all forms of malnutrition. Of course, the process and the outcome document have been quite heavily criticized as well by civil society and some social movements, but it's still an important document that has been adopted last year. Then there's the Sustainable Development Goals, so the follow-on from the Millennium Development Goals, and to be adopted in September. And so currently there is a goal included to reduce NCDs by 30% by 2030, which was not the case for the Millennium Development Goals. So that's an important document as well. Then WHO has established a high-level commission on ending childhood obesity. So they are preparing a report to be presented at the next World Health Assembly with some options on how to act to reduce child obesity. And then there's civil society together with academics who in the past have also developed some declarations or important documents, like for example the Sydney Principles to reduce food marketing to children, and more recently for example, the Bellagio Declaration on the countering of big foods, undermining of healthy food policies, which was produced by academics mainly in low and middle income countries. So the next thing that we might think about to accelerate progress is, of course, increasing the pressure from citizens. So movements are quite important and have been important in the past, mainly social and ideological movements, such as civil rights, animal rights, women's rights, and but for obesity, of course, it has been much more difficult to create such movements. And so one strategy might be to actually identify existing and emerging social and ideological movements that actually share behavioral goals with those for obesity prevention, and in this way strengthen forces to improve diets and reduce weight, for example. It's also important to create tools for consumers to actually make healthy food choices. So an important recent tool is the Food Switch app, which was actually launched in 5 countries across the globe, and is also going to be launched in some of the emerging countries like India. So the whole idea is to scan the barcode of the product, and then you can see the traffic lights for salt, saturated fat and sugar. And also the program gives you some healthier choices. So it's kind of a good tool for consumers to use when they go shopping. And an additional advantage is that it's a good tool for monitoring, because consumers also crowdsource extra data on food composition on food packages. So it allows for sustainable monitoring. So based on this example, we might also think about, are there any ways that we can engage and empower citizens to, for example, crowdsource data on their local community environments, and then automatically feedback these data to a range of local stakeholders like local government, but also schools, retailers, sport clubs, and in that way empower the public actually for local action to reduce obesity. I think public pressure, increasing public pressure is quite important because the government is more likely to act. And we know from polls and that sort of surveys that consumers and citizens are actually quite supportive of some of the policies that we are aiming for to reduce obesity, such as labeling or even taxes. And then the last point I wanted to highlight is community mobilization. So there have been a lot of community-based programs in the past to try to reduce obesity, but now the focus seems to be more and more on whole of systems approaches to prevent obesity, which basically shifts attention away from individual risk factors or really isolated interventions and considers many influences simultaneously. So a whole of systems approach is really about creating a prevention system and about activating and strengthening existing systems. So it's a totally new approach compared to what has been done in the past, and also new methods will be needed for its evaluation, like social network analyses and systems modeling, which are very much in its infancy, but it's hold big promise. So I think the best example at this moment is Healthy Together Victoria in Melbourne in Australia. So it's quite big, it's statewide, so it involves more than 4,000 workplaces, 500 schools, 14 local government areas. So the idea is actually strengthening the workforce. So about 170 people are funded across the state, so mainly in local government, community health services and NGOs, with the idea to actually deliver high-level policy and leadership for health promotion, but also to provide quality improvement frameworks for different settings, provide advice and support to create healthy canteens, and a whole range of other activities. So I think this approach really holds promise as well, and doesn't necessarily need to be hugely expensive, and it also holds promise to actually spread out to other communities who pick it up and start on doing it as well. So in summary, what can we do to accelerate progress? So we are consumers, citizens, communities, NGOs, and then researchers. So tools are needed for consumers to make healthy food choices. Citizens can create social movements, can also help crowdsourcing data and generate feedback loops to stakeholders with the data. Then there's the whole of systems approaches in communities for obesity prevention. NGOs can maybe explore a bit more of the underused levers to hold governments and the private sector to account. And then of course researchers, which I mainly am, we can engage in strategic science, so really looking to measure and benchmark government and private sector performance, and also really explore and assess case studies from around the world on what worked and what didn't. So this is it. Thanks very much. So if you have any questions, of course, feel free to ask. So I think over to Desiree again. I hope it wasn't too long.
No, that was perfect. Thank you so much, Stefanie. Now I'll just ask you to leave your slide up so that people can maybe have your contact information and follow up with you there as well. So as we move through to the discussion portion of this presentation, I'm so grateful that you presented such a detailed overview, both from providing your local perspective as well as more of an international level. So at this point in time, I will open up the floor to any questions from those that are joining us. I know we do have a few viewers watching from our YouTube channel as well as Google Plus page. And Anna, thank you for joining us as well in this call. perhaps I'll start off, Stephanie. You discussed in the last couple of slides about a holistic approach, so both from a civil society perspective as well as applying international pressure, and the success of, I guess, populations or the public on applying pressure to government bodies for accountability systems. Now, with the hand that governments play in, I guess, trade and importing and exporting of certain food products, would you believe that there's greater success from a local population to apply pressure to shape, I guess, the food system in a particular country, or do you think it needs top-down support of international partnership?
Oh, I think it's both. I mean, the local approach can mainly be useful as well when, for example, the political climate in the country is not that great to actually get some of the harder policies implemented. So if then citizens can be empowered to, in certain ways, to get more local action happening, then that's very useful. But of course, international action and especially the trade agreements are a real worry, because this area is also actually not well covered in these high-level documents that I presented in the beginning on what needs to be done. So trade agreements have not been covered in those actions, like the global action plan on NCDs, and are a real worry as well. And also because, like, the lay public doesn't even know what is the TPPA. It's kind of hard to explain as well. So I think, yeah, trade agreements are a real worry. We have to think more about how we can actually, yeah, move forward there. I don't know if anybody has any suggestions there, but it's yeah, it is a worry.
No, that's great. Stephanie, sorry, thank you for covering that. Anna, did you have anything you wanted to ask our guest, our speaker this afternoon?
Yes, please. Can you hear me well?
Yes.
Yeah.
Oh. Hi, Stephanie. I'm Anna. Thank you for your excellent presentation. It is very inspiring for me. I am a nutritionist and I work at a consumers defense organization here in Brazil. And I am thinking about all these issues that you pointed out in our presentation. One issue that I'm worried about here in Brazil is about how to give tools and training for public health professionals here that are already work in cities or states, and they are sensibilized. They are worried about these issues, but they don't know how to act. I don't know if you have this impression in other countries. For example, regarding food regulation, one of the most important topics that we work here at IDEC. These professionals, they don't know how to pressure the companies to work on better food labeling. They don't know how to pressure the government to punish the companies to those that don't follow the consumers code here in Brazil. And what I'm thinking about and try to work here this year is something about it, to tell them which are the possibilities, and because it's necessary for them to work in a more effective way with professionals from other areas, not just from health. So I don't know if you have thoughts about it.
Yeah, that's a great point, actually. I mean, one of the tools that I presented in the beginning could address this a little bit, like the food AP, because we've seen in New Zealand that by bringing together all these people, we had about, I think, 60 NGO representatives and public health experts and people from medical associations as well, almost forming a sort of a coalition to then actually together perform the rating of the government on how they were doing. And so we think that if we repeat this exercise over time, and if more countries are going to do that, and we can actually show the government how they are doing compared to what's happening internationally, that might be a potential way for the government to increase their actions as one thing. But of course, the pressure from public health professionals only might not be enough. So that's why involving the public as much as possible and actually more vocalize the demand for these policies by the public is also very important. So I'm not sure if that's very helpful, but that's kind of what I was thinking about.
Oh yes, thank you. That's very helpful. We are trying to do something like that here in Brazil too, but I think that we are discussing on a with few people. We need to include more people in this discussion. We have a task force to enhance and accelerate the bill proposals on food regulation and environment here in Brazil, with representatives from the government, from universities and civil society organizations. But my impression is that we need to expand this. You know, Brazil is a huge country, so we need to have more people engaged, I think. Thank you.
Yeah, thanks. But in some areas, though, Brazil is like best practice as well, because the new dietary guidelines that were published were really, really great. So I really like those very much. So I think in some areas, Brazil is actually doing really well as well in the area of nutrition.
Yeah, that's true. The new dietary guidelines are incredible. We think that we will be able to work a lot with and to engage more people with these documents. You're right.
Yeah.
That's beautiful. Thank you, Anna, for joining us in that. Now I will do one last call out to those of our viewers or those following us through Twitter to ask Stefanie any questions while we have her. Stefanie, again, I'll take this time on behalf of the Young Professionals Chronic Disease Network to thank you for, I know it's an early morning for you. It's actually in New Zealand right now about 6 a.m., 6:30 if I'm not mistaken. So we appreciate you more than words. So any questions we have for her, we won't take up too much more of her time. And I'm just refreshing our Q&A, and it seems at this stage there is nothing else to add. So Stefanie, I want to thank you for the fabulous presentation. For those that are looking to follow up with Stefanie as well, perhaps use any of the frameworks or connect with her in terms of the information she presented, please feel free to reach out to YP as well as myself, either through our blog at ypchronic.org or through Twitter as well. This video will be posted on our YouTube channel and can be disseminated from there. So Stefanie, thank you again, and I will conclude this week's session of YP Speaks.
Yeah, thank you very
Beautiful.
much, everybody, for joining.